Well, if you've been struggling with knee pain and you say enough is enough, there's a solution that'll get you moving in the right direction. Dr. Richard Ursone is a board-certified orthopedic surgeon at the SA Orthopedic Group, and he is here with some solutions for relief. Good morning, doctor.
Good morning. Thank you.
It is good to have you here because when it comes to knee pain, boy, does it really cover everybody, correct? I mean, everybody kind of suffers from some sort of knee pain.
That's right. There's a lot of ways you can end up with knee pain, be it genetic, old sports injuries, a little too much weight, but a vast majority of us are all going to get there at some point. Eventually, the tread's going to wear off our tire.
Oh.
It's going to happen, and we're going to have to deal with it.
We run like a machine, so we want to make sure that we go efficiently, correct? We want to make sure that we do that. Okay, so you've got a poster here. Total knee replacement is what it's called. Explain to us what's going on here.
Sure. Mainly, I just wanted to show that there's a lot of confusion about what is knee arthritis. Essentially, all that means is that when you wear this articular cartilage, which is that cartilage on the surface of the bone, that's your shock absorber. When that wears out, that's when you get a lot of damage. The bone starts to change, you get a lot of swelling and stiffness. So the main symptoms of knee arthritis are waking up in the morning with a stiff, painful knee that just progresses over the course of the day. It may not be that kind of sharp, locking pain, but more that dull, aching pain that just sort of grates all night, and you're popping Tylenol and Motrin.
Oh my goodness, it sounds painful. And so that's the difference between knee pain and knee arthritis, correct?
Right, right. Knee pain can be from a lot of different things, like meniscal tears, which is the soft cartilage between the bones. That's usually what you hear about athletes getting, or ligament injuries with all the football now. You hear that all the time in the news.
Yes, yes.
So we're really talking about the knee arthritis pain, which is really going to catch a lot of us as we age. So there's a lot of different options that you can do for knee arthritis. The traditional treatment is a total knee replacement, which is where we're really addressing the entire knee joint. So a lot of patients will come in and they're very confused. They think, I'm going to take out everything from here to here and put in a whole bionic knee. And that's not really what we do.
Right.
This is an example of a total knee replacement. So it's the surface of the bone that's really worn out, and that's all we want to replace. And so we'll make cuts, and it's essentially like a cap that will go on the ends of the bones. But we keep all the ligaments. That's what kind of holds the knee together. So this is when the entire knee is worn out. Well, what if that's not your case? What if only part of your knee is worn out?
Yes.
And so the next option is if it's just, say, on the inside of the knee, which is about 90% of people.
That's common, right?
Will just kind of have cartilage worn on this side, but the lateral half and the patella, that's in good shape. So you don't want to replace their whole knee. It's not necessary. This is a much smaller surgery, a lot less invasive, a lot quicker recovery. And what we're doing is we're really just replacing the surface on the medial side of the knee, so the femur and the tibia.
I see.
So that's a much quicker recovery, allows people to remain pretty active.
And when you say quicker, how long are we trying to recover?
I'd say within about 6 weeks, most of these patients are up and getting back to regular exercise and get their main motion back, their swelling's down a lot quicker. So knee replacement, a full knee, you're looking at about 6 months. A partial knee, maybe about 3 months.
Oh, okay, totally. That, I mean, just really half the recovery.
Right. And so then our last option, this is kind of a newer option. This is for very limited areas. So let's say you only have one small divot in the cartilage in one spot. Well, it doesn't make sense, again, to replace cartilage that's not damaged. We're not as good as God is. So what we really do is we can focus on areas where you can just replace, let's say, the cartilage under the kneecap. You can put a small cap there. Or if it's a lesion just on the femur, you can do this where it's really contoured just to the surface of the bone. It preserves all of the meniscus, all the remaining ligaments, so it's a lot less invasive. And again, this surgery can really be done as an outpatient most of the time. We're getting to the point where the partial knees can be done as an outpatient as well. So that's less hospital costs, quicker recovery, less risk of being in the hospital. So
yes,
pretty exciting stuff.
Exactly. That does sound exciting because that's what we want. We want to make sure that we are able to, rehabilitate quickly.
Right.
Yeah, exactly. Okay, so if you would like a solution for knee arthritis, here's the information on the screen. SA Orthopedic Group, there's the phone number right there, 210-396-5248. And you can also check out their website. That's TSAOG.com.